This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. Dave Wilson with you. Our guests this morning are Jamie McLaughlin, Senior Director, Critical Care, Nursing Operations at Mon Health, and Cheryl King, Core West Virginia Community Outreach Coordinator. Jamie, Cheryl, good morning.
Good morning. Good morning.
Thanks for taking some time this morning. April is Donate a Life Month. We'll get into that in just a moment. But first, we always have to talk about you for at least a minute or two on the program this morning. So we'll start with, eeny, meeny, miny, mo. Jamie, since your name's first on the list, we'll toss it to you first. Just tell us about yourself, your background, education, training, how you ended up with Mon Health.
Well, I'm local to the area. I've been a nurse here at Mon Health for over 30 years, which is hard to believe. I have a master's degree in nursing with a clinical practice focus in critical care. And like you said, I serve as the Senior Director of Nursing Operations here at Mon Health and the Critical Care Service Line. I've always chosen to work in a community hospital. We have state-of-the-art technology. We have an exceptional staff of physicians and nurses, and we provide exceptional care to our patients.
Now, Cheryl, you're with CORE. What is CORE?
CORE stands for the Center for Organ Recovery and Education, and we are out to educate the public and the community about the importance of donation and transplantation.
Well, how did you get involved with CORE?
I worked for a communications firm that did some work for CORE, and I was fortunate enough to work on that account. And the more I worked on it, the more I felt that was a passion that I wanted to pursue. So I went to work for CORE.
Well, Jamie McLaughlin is the Senior Director of Critical Care Nursing Operations, Mon Health. Cheryl King is Community Outreach Coordinator with CORE. Since we've already started to touch on what CORE is all about, maybe you can go into a little bit more detail, Cheryl, what the mission of CORE is and how that relates to Donate a Life Month.
Okay, the mission of CORE is to save and heal lives through donation, and National Donate Life Month is an observance that focuses national attention on the need and importance of organ, tissue, and cornea donation. So we want people to understand the importance of registering to be a donor, and we also take the time to honor the deceased and living donors and celebrate the lives that have been saved.
Cheryl, I don't think it's much of a stretch to say there's probably for the average person 2 times in life when you think about organ donation. One is when you get your driver's license and you have to check that box yes or no. The other is if you or someone close to you is in need of an organ transplant. Those are probably the only 2 times the average person gives it a lot of thought. Is that a fair statement?
That's a very fair statement. So we try to get it out there to have people think about it before something happens, because we need people on the list. That way, if there is a need that arises, they can get a transplant sooner. And you also don't want to put your family through having to make that decision. If something terrible were to happen, if you can go ahead and make that decision, then that's something that your family doesn't have to decide at that time.
So, Jamie, how does Mon Health work with CORE to encourage organ donation?
Working with the Center for Organ Recovery and Education, or CORE, has been a part of us here at Mon Health to raise awareness for organ donation as far as back as I can even remember. We very actively participate in educational opportunities, both within our hospital staff and our community. We do lots of table displays. We participate in flag raising events annually, and we consistently do house-wide staff education as well.
Cheryl, here in West Virginia, how many people are waiting for a life-saving organ transplant?
There are currently about 500 West Virginians that are in need of a transplant, and most of those are kidney transplants that are needed. So if you think about West Virginia, I was born and raised here. We do for others. You know, we're quick to help our neighbor and quick to come to the aid of others. And I just think this is another perfect example of how you can do that by signing up to be a donor.
How often are people added to that wait list?
Every 10 minutes, someone is added to the National Transplant Waiting List. And that is just a statistic, you know, I think blows my mind when I think about it.
Yeah, that is hard to believe that every 10 minutes there's somebody. And that, Cheryl, I don't even know if you can speak to this, but that has to be excruciating just to be on a list and know that every time your phone buzzes, every time you get a message from the hospital, that could be the one, and that could be several days, it could be several weeks, it could be several months, who knows how long that has to be an excruciating time for the patient and their families.
Yes, I've talked to many families, and they have a bag packed by the door, and, you know, lots of times they don't travel outside of a certain area. So in case they get that call, they can get to the hospital quickly. It almost puts your life at a standstill in a way, because everything that you're doing revolves around getting that call and being able to get there in a timely manner.
Because once you do get that call, it's not, hey, next Tuesday at 3, it's get here now. It's happening. It's happening right now. It's an immediate response.
Correct. And I've also known, you know, people who have had to say, I'm sorry, I'm out of the area and I can't get there. So, you know, sometimes people, if they don't stay close to home, they have to, you know, pass on getting an organ.
Jamie, can anyone be a donor?
Anyone can be a potential donor, regardless of their age, race, or medical history. Because we have more than 90,000 people across the nation awaiting a kidney, this is the organ in greatest demand, followed by liver, heart, and lung.
Talking to Jamie McLaughlin, Senior Director of Critical Care and Nursing Operations at Mon Health. Cheryl King is Community Outreach Coordinator with CORE West Virginia. We got to squeeze in a quick break. We'll continue our conversation as Mon Health Talk continues here on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Jamie McLaughlin, Senior Director of Critical Care Nursing Operations, Mon Health, and Cheryl Cole, West Virginia Community Outreach Coordinator with CORE West Virginia, joining us on the program. Cheryl, how many people can one donation help?
One organ donation can save up to 8 lives, and a tissue donor can improve the lives of more than 200 others. And yes, I said 200 others. And I know that may be hard for some people to comprehend, but tissue includes your skin, it includes your tendons, your bones, and also people can donate their corneas to give the gift of sight. So one person can make a tremendous difference in hundreds of people's lives.
Cheryl, obviously, for trying to say this as sensitive as I can, obviously someone has to lose a life to donate some of the organs, obviously, that we're talking about, heart, lungs, all these systems that you've brought up. So what is the family members' reactions afterward? I generally see very positive reaction, that the fact that a loved one that they may have lost for whatever reason has been able to help someone else continue living. So what are the reactions you hear, and what are the reactions you see?
It gives great comfort to the families to be able to know that their loved one lives on in some way. And lots of times they will get together with the recipients, and it just gives them a hope. And we always try to make sure that they realize that their loved one was a hero for giving selflessly even after they passed.
That's not always the case. I mean, you mentioned earlier that kidneys number one on the list, people waiting. How often is that, a family member, a father and son or mother, whatever the case may be, that they are able to donate a part of themselves to help their family member?
Yes, living donation is becoming more popular, and you have to go through a lot of testing, and family members are always excited when they are the ones that can give the gift of life to their loved ones, and always so disappointed if there has to be additional testing outside of the family.
Jamie, hospitals across the Mon Health system are going to be hosting a flag-raising ceremony in mid-April. What's that all about?
Every April in the United States, hospitals across the country raise the Donate Life flag. We fly these for the whole month of April to spread awareness about organ, eye, and tissue donation. And it's also to honor those who gave the gift of life. This observance commemorates organ donors and their family, and it's a nationwide display of unity, remembrance, and hope.
And when will that be taking place?
Here at Mon Health, it's April the 11th at noon.
Can the public attend?
Sure, the public's welcome to attend.
And Cheryl, how do you go about signing up to be a donor? Is that a tough process? Is that as simple as checking a box on your application? How do you go about the process?
Well, there are 3 different ways. When you sign up for your driver's license, you can become a donor. Or when you sign up for your hunting and fishing license, you can become a donor. Or you can simply go to core.org/register and become a donor today. And that takes less than a minute to do that on the computer.
Have you ever talked to individuals who were not a donor and then later changed their mind and kind of picked their brain to ask why they had a change of heart?
The best people that we have that go to different volunteer functions with us are our volunteers, and they have their personal stories of what they went through, either as the donor family or as the recipient. And those personal stories are usually what gets someone to change their mind. And a lot of times they say, well, I just never thought of it in that way.
Yeah, I imagine that those personal stories, it's easy to say no, I guess, is what I'm saying, Cheryl, if you're removed from it and have not really been impacted by it. But when you hear a personal story or you have a personal experience, it certainly will change your outlook on the way you, I assume the way you view a lot of things, Cheryl.
Yes, absolutely. It does. And, I mean, it's really not something a lot of people like to talk about. I mean, nobody really likes to talk about death, but we are trying to be proactive and get people to realize that this is a gift that you can give to one person or to many people.
Jamie, do you see some of these same things, or have you had some of these similar conversations with patients of yours or just working through the medical profession?
Well, actually, even in my own life, I was not an organ donor in the past. And then because of, listening to these wrenching stories of, patients have suffered waiting for an organ, or the heart, generosity of families donating, I changed my own story and became an organ donor. So, with anyone being a potential donor, we are working very hard with CORE to help these families.
April is Donate a Life Month. We will continue our conversation and wrap things up with Jamie McLaughlin, Senior Director, Critical Care Nursing Operations, Mon Health, and Cheryl King, Community Outreach Coordinator with CORE West Virginia. We'll continue the conversation right after this.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guests this morning are Jamie McLaughlin, Senior Director, Critical Care, Nursing Operations, Mon Health; Cheryl King, CORE West Virginia, Community Outreach Coordinator. Got a couple of minutes here for both of you, and I want to ask you both the same question. Jamie, I'll start with you. Just what do you want people to take away from our conversation today?
I think probably the most important thing is there's such a need for organs and tissue. If you have any questions, please, give one of us a call, as Cheryl said. Things like National Blue and Green Day, Friday, April 14th. We're working to raise awareness for organ donation. So any questions at all, please call, so we can give you some more information.
And Cheryl, same question to you. What do you want people to take away?
I want people to think about what if they needed an organ themselves, or what if their loved one needed an organ. That would certainly change your decision about the importance of organ donation. And we just, again, anybody can contact either one of us for information. My email is cking@core.org. And we just want to know that we want everyone to know the importance of saving lives and the importance of your loved one living on as a hero.
Yeah, I was going to ask you there, where can folks reach out for more information? Just give that information again, Cheryl.
My email is cking@core.org.
And Jamie, how can folks get in touch with you if they would like?
It's McLaughlin.J@monhealthsys.org.
Jamie McLaughlin, Senior Director, Critical Care, Nursing Operations, Mon Health; Cheryl King, Community Outreach Coordinator with CORE West Virginia. Thanks so much, guys. Appreciate it. Great conversation today. Thanks again for your time.
Thank you so much for having us.